Hi, my name is Dr. Samantha Byrne and I'm one of the lecturers at the Melbourne Dental School at the University of Melbourne. Welcome to the Doctor of Dental Surgery information session. I'll be talking about our Doctor of Dental Surgery course today. So where is the Melbourne Dental School? The Melbourne Dental School is located in Parkville in association with the University of Melbourne. We're just opposite the main university campus across two locations. We are at the Royal Melbourne Dental Hospital on Swanston Street, and then a little further down the road at the Melbourne Dental Clinic. So why study at the Melbourne Dental School? We have a fantastic reputation both locally and internationally. If you have a look at the international rankings of dental schools for quite a few years now, the Melbourne Dental School has been the highest ranked Australian dental school internationally. How are the rankings determined? They're determined by looking at things like quality of teaching and learning, the quality of the research output that comes from the school, and also student satisfaction. So what that ranking tells us is that we have a fantastic quality of teaching and learning at the Melbourne Dental School, that the research output is of very high quality. In fact, many of our lecturers are leaders in the field in which they research, and our students are really happy with the education that they receive here. So we have a number of courses available at the Melbourne Dental School, and the course we'll be talking about today is the Doctor of Dental Surgery, which is the degree you do if you would like to be able to practice as a dentist. Following on from that, if you wish to practice as a specialist, you would then do a Doctor of Clinical Dentistry after carrying out a number of years of private practice or of clinical practice after graduating. So the Doctor of Dental Surgery is a 4-year full-time extended master's level degree. It leads you to be registered as a dentist with the Dental Board of Australia. The degree is also recognised in New Zealand and in Canada. Throughout the course, students study in a variety of areas. Some initially basic sciences like anatomy, biochemistry, and microbiology, and then leading on to clinical dental practice areas of study. There is some exposure to specialist dental care, as there are some procedures that are able to be undertaken by general dentists. However, this study that's carried out as part of the Doctor of Dental Surgery doesn't allow you to practice as a specialist in these areas. You would need to go on and do further study in order to be able to work as an orthodontist or an endodontist, for example. So over the course of the degree, the first year is science and preclinical education with some initial dental practice, but not on patients. So things like infection control and learning how to work safely and ergonomically in a dental practice. As you move into second and third year, you start seeing patients and have a combination of clinical and also lecture-based teaching. The fourth year of the degree is a full-year subject called comprehensive dental practice, and that's where you undertake a number of clinical placements or rotations in a variety of different clinics outside of the, both inside and outside of the dental school. With some mainly clinical practice in fourth year. There's also a dental research project that extends currently across half of first year into second year and into part of third year as well. So where are the clinical rotations carried out? When you're in your fourth year, you work at the Royal Melbourne Dental Hospital and the Melbourne Dental Clinic, but also the Melbourne Dental Hospital, and we have rural clinics in Shepparton, Moe, also work in a variety of community health centres like Banyule and Midri. So when you graduate with a Doctor of Dental Surgery, what are your career options? The majority of graduates take up clinical practice, treating patients in private practice, in public dental clinics, and some of our graduates work across both those practice types. If you're particularly interested in further study after a number of years of clinical practice, you can apply to return and do specialist training, which is carried out as part of the Doctor of Clinical Dentistry if you wish to practice as a specialist. We also have a number of clinicians who return to do research. There are a number of opportunities to do master's courses or PhDs in a variety of different areas of both clinical or laboratory-based research. If you do wish to return to do further study clinically, there are Doctor of Clinical Dentistry courses that run in a variety of different areas. For example, in endodontics, in prosthodontics, periodontics, orthodontics, a variety of different areas depending upon what your interest is. So what are our facilities like at the Melbourne Dental School? We have a number of state-of-the-art facilities in which our students are able to train, particularly at our Melbourne Oral Health Training and Education Centre, MOTEC, in Swanston Street. We have some amazing facilities that enable the students to gain the manual dexterity that's required in order to be able to practice on patients. Students start on virtual reality training systems, which enable them to get practice in being able to prepare teeth for restorations. They are then able to move through to a preclinical facility where they work with a head that's also connected to a torso. It's like a little mini dental surgery, enabling them to gain clinical experience prior to treating patients. So once you start working on patients, and our students also work out of the Melbourne Dental Clinic, which is set up like a real-life dental clinic so that you're able to treat patients in a setting that's very similar to the way that you will treat them once you have graduated. What are the entry requirements into the Doctor of Dental Surgery? In order to apply, you need to have a 3-year undergraduate degree with prerequisites in anatomy, physiology and biochemistry, all at a 2nd-year level. And you also need to have completed the GAMSAT, the Graduate Australian Medical School Admissions Test, or equivalent if you're an international student. If you're unsure whether the subjects you are doing or wish to do meet the prerequisite requirements, you can go to this website that's on the screen looking at prerequisites and search for your subject and find out whether or not it will be able to provide you with that prerequisite requirement. What marks do you need to get in? It's certainly a highly competitive entry into the Doctor of Dental Surgery. The marks, so study marks, GAMSAT marks that are required each year depend upon the cohort of students who are applying in a particular year. So we don't know what the score is going to be until after the students have applied and the positions have been determined. So what do our students say about studying the Doctor of Dental Surgery at the University of Melbourne? I've spoken to a number of final year students and largely the most common comment that comes up is that students love seeing the patients. They love starting to see patients in 2nd year. They love that they get 3 years of clinical experience working with patients. They love the experience of being able to help patients. They love being able to follow patients through for their entire 3 years of their course. So you will find some patients that you're allocated in your 1st year of clinical practice. So in 2nd year, you'll be able to follow those patients through and carry out all the required treatment for those patients. Students love that the appreciation that the patients show for having their problems fixed and being able to prevent further dental issues in the future. Students really enjoy the interaction with the demonstrators who teach at the Melbourne Dental School. We have a number of fabulous clinicians who volunteer, many of them, to come and teach, in particular a number of specialists who come in and give up their time to help with the education of our students. It's quite a small cohort. We have around 90 students who come in each year, so you get to know your fellow students very well, and they are people that you will continue being friends with for life. As well as study, there are a number of different extracurricular activities that our students participate in. The Teddy Bears Hospital each year, in association with the Good Friday Appeal, is highly competitive, and students love being able to spend time interacting with children and their teddies. We've got a number of students on the left of the screen who have completed a placement in a remote Indigenous community. And I was also speaking to a group of students earlier in the week who've just returned from volunteering in Cambodia to provide dental treatment to people there. I'd just like to point out the graduate access, Melbourne access into the course. There are a number of conditions that need to be met, or circumstances that need to be met, so it's well worth checking out the Graduate Access Melbourne website to get some more information about access to the Doctor of Dental Surgery through there. So you might still be asking, is dentistry right for you? If you are good at working with people, if you're good at working with your hands, if you have fantastic attention to detail and a genuine interest in preventive healthcare, then dentistry may well be right for you. If you are wanting to find out more, I would highly recommend contacting your family dentist or your local dentist and asking if you can come and spend some time in the surgery with them, sitting with them, talking to them, observing what they're doing. And that's a really good way of getting an indication of whether or not you think dentistry might be for you. Thank you.